I am from EAFIT University and for the group of research on spatial economics, the RISE group. My project is called Urban Form and its Impact on Sustainable Development. And we are focusing in three questions in this project. One is about the socioeconomic stratification system that is implemented in Colombia to make public services available to an affordable cost to the poorest people. But we think that that is creating also some kind of issues on the cities because we see huge extensions of the cities with the same socioeconomic class, and we think that that is creating constraints to social mobility and things like that. So we want to analyze that, and we have also some stakeholders like UN Habitat interested in changing that system. So we're trying to gather some evidence to come up with something, and then new ideas to come up with a different system and a different proposal to trying to make things better inside the cities and try to promote more social mixing in our cities. That's one of the questions. The second question is related to the presence of urban green spaces. How are they distributed within the city? Because that we see in most of our largest cities in our country that the wealthier areas have a lot of green spaces and the poorest areas have almost none. So given that the green spaces have so many benefits to the environment and also to the people, to the health of the people, we think that all the people should have equally access to the green spaces. So we want to make this problem very visible with data and evidence in order to also to try to make a change in the policy making about that and to change how urban planners think about that from the government, you know, especially for the poorest in the people, for the poorest in the cities, excuse me. And the third question is about the geographic accessibility to healthcare facilities in our cities, because there is a problem with that also. But it was very interesting with this issue in the proposal, because the first thing that we wanted to analyze was if everyone have access to healthcare facilities in the city at a reasonable time, travel time. But then we had a conversation with politicians and people from the local government, from the health secretary of the city hall. And they told us that the Colombian situation is rather different from other countries because you cannot go to any hospital, for example, but you have to go to the hospital that is assigned to you, but the insurance company that you are registered on. So that is creating an accessibility problem that is, I think that is worse than we thought at the beginning. So we want to compare what are the costs of these situations of that you have to going to a specific place instead of going to the nearest place. So I think that would be amazing if we can demonstrate that there are huge costs associated with that in order to show the politicians that the system is creating that accessibility problem in our country. The first is that we are in an interdisciplinary theme. In our group, we are all from different backgrounds, economists, mathematicians, engineers, and geographers. So we think that combining these methodologies, maybe we can come up with different methods or different approaches to how to look at the data and how to produce new results. And then the other part is that since the beginning of the proposals, we were looking for stakeholders, looking to engage people from the local governments or even the national level of the government. And that's been very slow, very difficult, but at the same time very productive because, like I said before, It has implications in our approach to the problem, to the issues, changing the questions from the initial thoughts to something that is more relevant to the politicians or to the people in the government. And for example, the example from the health secretary is one of them, because we had to change our approach to the question for something more relevant, and the rationale behind that is that the people from the government told us that they need some real evidence in order to talk to the other people inside the government that is in charge of urban planning to make things better, because they lack at the moment the evidence to justify or to, to give more power to their arguments. So I think that is one way in this is going to be maybe make a little difference and a real impact in the way that people make decisions in the local governments in the cities.